Hi, I'm Andrea Crane. I'm one of the nurses here at Cynthia Gregg MD Face and Body Specialist. And I want to talk to you a little bit today about one of my favorite fillers. It's Restylane Refined. It's one of the newer fillers that has come out about, I don't know, 5 years ago maybe. And the reason that I love it is because it is a very natural filler. I like to use it in the lips. I like to use it around the corners of the mouth. It's primarily the biggest area that I use it in. Sometimes I'll use it in lip lines. Actually, a lot of times I do use it in lip lines. And I like it because it integrates so beautifully into the skin. You don't even look like you've had anything done. You just look very natural. But you have a softening of those fine lines above the lip. You might get a little bit of lip volume, but if you are after a bigger lip, then it might not be my product of choice. But these days, I think most people are looking for a more natural lip. Don't you agree?
Yes.
Yeah. So my favorite product is Restylane Refined. It has expression technology, which means that it has strength and stretch. So I use it again in areas around the mouth because I don't want people to look sharp or edgy or like they've had anything done. Agree?
I agree.
Okay. Melissa, what's one of your favorite products?
Well, if I had to pick one of my favorite, I would have to say I like the RHA profile. RHA2 is a newer hyaluronic acid filler. Kind of like what Andre was saying, it integrates really nicely in the dermis. So when you put it in little fine details around the mouth, when somebody expresses or articulates or purses, you won't see it. It looks natural and soft. And sometimes with our techniques, we can actually make it look almost like an airbrush look depending on the patient. Again, it is based on assessment if you're a good candidate for it, but I really do love that product. In the lower face, we all use that one as well. The other product I would have to say is one of my favorite is going to be Jupiter and Voluma. Voluma, I like personally using it in the mid face, the cheek, and the temple area. And what we're doing is just kind of lifting up tissue with that one. It lasts a good amount of time. Also, jawline contouring is a great one for Voluma. All of us nurses use that one as well, but I would have to say that's one of my favorites for lifting on the jowl
And
area.
I'm glad that you said that we all use it because I just want to be clear in that just because we might have a favorite product doesn't mean that we don't use any other product, right?
Right.
We just, might prefer that in one area, but we do
Yeah.
all use Voluma. We all use Restylane Refined. We use a variety of different products, right?
Yeah.
It's like we're
Yeah.
artists that have different paintbrushes that we can use.
Exactly.
Right.
Yeah,
What's
that's a
your
good
favorite
analogy.
product?
One of my favorites is Sculptra. It's polylactic acid. It's basically what would be if you had your gallbladder out and the surgeon had sutures that dissolved. So it's biodegradable, biocompatible. You don't have to worry about any allergies. I like it because a lot of people don't use it. I've been doing it probably about 16 years now, and I've had great results with it. For people who don't want to look too puffy, especially my thin, older people that really just don't have a lot of tissue support, it's a great product because I go slowly with it. I inject you. You look great when you leave. All of that changes. In about a day or two, your body will absorb the sterile water that we mix with it. And then over time, about 6 to 8 weeks, you'll come back in and we'll do another treatment. I usually do one vial at a time. Again, we always have your baseline photos, especially with this product, because it takes a while for it to really get to your final result. But I like it because not only am I providing volume with it, I'm really helping your body to make collagen. So it also helps indirectly with fine lines as well. So it's a great product to use. There's a little homework involved. That's a product that you have to do some massage. I'll inject it typically in this area below the cheekbone to kind of widen and support your face. Good news is FDA approved the last 25 months, so it's helpful to know where we ended. People come back to me a year. Do I need a little touch up or not? And we'll go back and look at those photos. Some people do need a little vial at the year mark. Other people can go a full 2 years.
Yeah. Good. I do like the Sculptra also as an adjunct sometimes to hyaluronic acid fillers. So patients in the younger population, we also can use it to biostimulate or build collagen. So it might not be our primary source of building volume, but secondarily, it can be used to prevent collagen degradation. So it's kind of like a collagen booster, so to speak. So Sculptra has so many forms, like Nina pointed out, and we enjoy that product a lot. Yeah.
Okay, great. So now I want to talk a little bit about one of the newer areas that we are injecting. It's the chin. It was about a year ago that it got FDA approval, and we're so happy that it did because it plays a very important role in balancing the face. So for me, when I have a client that comes in that wants to have their lips done, it is a very important part of the assessment because we would like to keep everything in balance and we try to have everybody look very natural. And so the chin becomes a factor in if I'm going to inject somebody's lips. And one of my favorite products for that can be Voluma. It can be Restylane Refined. It can be RHA4. So we have a variety of different products that we can use to inject the chin. And it really does depend on the individual. So if you have a thicker skin, I might choose Voluma. If you have a thinner skin, I might choose RHA4. Another one of the areas that I like to inject that a lot of patients are not aware of, we call it the Nefertini Lift. And it's where we inject the depressor muscles of the lower face. So we inject the platysmal bands, we inject this muscle called the depressor angularis oris, and we inject the mentalis muscle. And when we inject all of those in combination, it allows the elevator muscles of our face to work more efficiently, giving us a sharper jawline and smoothing out those bands in the neck. And that's one of my favorite things to do for somebody that is complaining about jowling. We do it a lot of times in conjunction with filler of the midface to help lift the jowl, but that's a key component, in my opinion,
Agreed.
in trying to ease that jowl.
Yeah.
Agreed?
Agreed.
Yeah. Good. Okay. So Melissa,
So
what are your favorites?
Gosh, so I think an area that I really like to treat that is not necessarily widely known would be body contouring with Botox. And all of us nurses do this here, but I like it because Botox works with muscles. So patients will often come in and want some type of slimming to the back of the shoulders, or even like Andre was saying, the jowling. Botox can be used in many forms to slim the body and actually help with tension in the neck, TMJ associated pain. So I like using it for body contouring, specifically the traps. So women will have broad shoulders. We can use Botox in that area to slim out and give a more feminine frame. We have a before and after on our website of one of our patients, and it's 2 weeks after injection, and it's quite remarkable how you can body contour with Botox. Additionally, TMJ Botox we can use to soften the pain associated with TMJ, but also slim out the jaw. So a lot of things can be done with Botox and body contouring and slimming of the jawline. The other thing I really enjoy doing, and we all do that as well, is a hyperdilute radius to the body. Crepey skin, you can't work up skin no matter what you do. So we take this product and we dilute it down and fan it under the areas that have crepey skin. And what it does is stimulate collagen. So you can address chest wrinkles, necklace lines, arms, above the knees, just anywhere you have really crepey skin. Again, you have to be assessed by one of us to determine if you're a good candidate. But I do enjoy doing body as well. So, yeah, what about you?
One of the areas that I like to inject with Botox or any of the neuromodulators that people don't know about is jelly rolls. When people smile, everybody knows about their crow's feet and the corners of the eyes, but people don't know that they'll get just a little bit of a roll underneath their eyes. And it's not on everybody, but with a pretty low dose, it can make a significant impact and just kind of relax and make the eye appear bigger. I also like to inject with really any of the hyaluronic acid products that we use. Especially if I have just a little left over, I'll put it in someone's earlobes. I had one of my clients that of all the things I did for her, she was the happiest with her earlobes. She had beautiful jewelry that she hadn't been able to wear for years because it kind of rolled down. And by putting a real small amount, she came in with her nice diamonds again that she was thrilled that she could take out of her jewelry box and wear. And again, it takes very little product for that. Another area, I talked with Melissa talking about doing body work are the hands. I think they're often forgotten and they really show our age. The face is looking great and then all of our sun damage on our hands. So, as we get older, that skin thins out and we can start to see our blood vessels and the tendons. So I use dilute radius. I don't thin it out as much as what Melissa's talking about with other body parts, because I found the sweet spot to be a 1-to-1 ratio where I want some volumizing, but I also want to stimulate your collagen. And usually with 2 syringes, usually 6 to 8 weeks apart, I can have a great improvement with somebody's hands. So that's kind of a fun, I think, neglected area.
Agreed. The hands, especially like Nina was saying with jewelry and women having gorgeous jewelry and the hands aging them. But yeah, I definitely agree. And I think we all inject with that ratio. Just the crepey skin, we're going to do a more diluted version. And with the hands, we're to give a little bit of volumization. But yeah, no, that's a great tip.
One question that I get a lot is, well, how come my friend or sister gets 15 units of Botox somewhere, and why do I need so much? Or how do you figure out what I need? There's certain FDA-approved doses that we use as guidelines, but there's tons of variable. Men always take a bigger dose. Someone that's new to a neuromodulator is typically going to take a higher dose. Some areas require more than others. So what we always try to figure out what your main concern is, and then find a dose that we think will get you happy. Again, you'll come back in about 2 weeks. We'll reassess you. If we need to do more, then we can certainly do that. But we're always trying to find an appropriate dose for you. The other thing we care about, what's great, let's say you come back in at 2 weeks and we're both thrilled with your results. We care about how long it lasts. FDA approved to last 3 to 4 months. If you come back in at 2 months and have a lot of motility, we really need to titrate that dose up some. The other thing depends on how many places we're putting it. You know, the units start to add up when we're doing multiple areas of the face, but we can really do a lot with neuromodulators. So we really customize it. I've got 2 twins that I see, and they are completely opposite in the way that I treat them. So just because your daughter or your sister or somebody else gets a certain dose, you know, we're going to really help you figure out what's best for you.
It's all pretty individual, which leads me to my next most commonly asked question, which is, how do I know how many syringes of filler I need? And again, that is based solely on you as an individual and your skin quality, your desires, your budget sometimes. And so I would say that's a really hard question to answer. How many syringes do I need? You need to come in for a consult and we can break it down for you. But basically, in each one of our syringes, there's 1 ml of product, and that equates to 1/5 of a teaspoon. And so we try to keep things looking really natural, and I think we're really very good at that. But that sometimes means a little bit more than 1 syringe of product, even to just get you off the ground, you know. So I know when patients come in and they have a lot of volume loss in their mid-face and they only want 1 syringe, sometimes it's impossible to make somebody happy with 1 syringe of filler if they really need 2 or 3. Agreed?
Absolutely.
And we're really good at what we do. And so why I say that is because we will utilize that 1/5 of a teaspoon to give you the most efficient results with that product. It's a quantity-based assessment. So when we assess you and sit down, it's almost like being given a prescription. We'll have to assess your face and determine in order to get a certain outcome, you will need X amount. So that's what Andrea and Nina were talking about with dosing. It's really customized to the patient based on so many variables. But again, we're very good at placement, and we're going to not hide the filler by, placing it too deep or maybe something a novice injector would do. So you're going to get the most out of the product. It just is going to depend on how much you need.
Right.
The number one reason people are afraid to have aesthetic procedures is the fear of looking unnatural.
True.
And I don't think that would be a concern here.
No. Yeah, you don't have to worry coming in that you're not going to, if filler's done correctly, it's not identifiable by a stranger.
True.
And so if you're walking around Harris Teeter and somebody looks at you and says, oh, wow, those are some great cheeks or lips, that's not the goal that we here are going to, help you achieve. So natural, conservative, soft, youthful, hydrated, refreshed, rejuvenated, those are things you can think about with filler here with us. But that's a great point.
Yeah. And I think it's so cool that as nurses, what we can do non-surgically, we've all been injecting for years, And times have changed so much
They
for the
have.
better, and we're always on top of the latest and greatest techniques and helping each other.
I would say of late, I've been getting a lot of patients that really want to have something done to their lips, but they're just afraid because they may have a friend that just looks overdone. A lot of patients are so fearful of looking overdone. And I can say with the new fillers that we have these days, especially for lips, patients don't have to look overdone. If anything, we might have patients come back and want more, or we might have to bump them up to a firmer, sturdier product because maybe it was a little too natural, right? Yeah, I'm seeing that more. Where patients are so happy, but maybe they want a little bit more. And that's much better than somebody feeling like they have too much.
Agreed.
Right.
Yeah, I think lips are the scariest for patients to delve into, but as we age, our lips age just like other parts of our face. So it's valid to want hydration or structure in your lips. The rest of your face is glowing and looking beautiful, and if the lips are
So
shriveled and
true.
atrophied, we can provide hydration, structure, give you back those little details, but without looking done.
Yeah,
so
it
to
is.
speak.
It is a detail.
Yeah,
It's
yes.
right. I mean, so
Yeah,
you've
hydration
made
detail.
everything else look really good, and then sometimes the lips just look a little dehydrated, and we
Yeah.
can just add hydration really without even adding volume.
Yeah.
Right.
Thank you so much for viewing our presentation today. We look forward to meeting you. Again, you can call our office to make a consultation to determine if you're a good candidate for non-surgical options. Also, if you subscribe to our YouTube channel, you can see our latest and greatest and all of our updates. Also, look on our website for our before and after photos and education about our procedures. The three of us are warmly welcoming for you. We look forward to meeting you. Also, thank you so much for joining our Patient Appreciation Day today. We look forward to seeing you in the office.